Well, I am the mother of 4 children, 3 girls and a boy. The grandmother of 4 children, 3 girls and a boy. I live here alone. I have been diagnosed with a heart condition called AFib, and along with that I have high blood pressure.
Remote patient monitoring is a way to monitor a patient outside of the physician's office. What always bothers me, even in medical school, I noticed that we make life decisions based on a visit every 3 to 4 months. I always question that because a lot of things happen within 3 to 4 months. And as we well know, this area is a quote unquote the stroke belt because there's chronic diseases, hypertension and diabetes and heart failure. And remote patient monitoring helps us to maintain a patient. It's easier to prevent a disease than treat a disease.
Remote patient monitoring, you consider it as an aspect of telehealth. We're able to connect with the patient. We can see their vitals, see those readings on a day-to-day basis and still check in on them. So even though they can't physically come to the clinic, we're still able to keep our eyes on them from day to day and even on the weekends.
We distribute cellular or Bluetooth devices that run off of a fusion network. So the patients receive these devices in their home, whether it be a blood pressure cuff, a pulse oximeter, a glucometer, or scales, depending on their chronic disease, whatever they qualify for. And then they're able to monitor their readings in the comfort of their own home, and then they transmit to a dashboard that myself and the providers and the staff at the clinics monitor.
It helps me tremendously because I've learned more about how my body reacts, to and all that, and to medication. I know one incident where I was feeling terrible and bad, and I went to Dr. Brown and I said, Dr. Brown, I need you to do something for me.
We treat 95% of patients, but if a patient has had a heart attack or heart condition, they will see a specialist cardiologist. And the cardiologist put the patient on what's called a beta blocker. It's a blood pressure and a heart medicine combined appropriately, and gave her the medicine and said, see you back in 3 months. Just so happened she had a side effect from it. And sometimes patients do have a side effect from the medication. It lowered the blood pressure too much and it lowered the heart rate too much. And we caught it. Cameron caught it on the remote patient monitor.
The health data is monitored through our monitoring platform. It's called Carium, and it's a dashboard that has each of the patients that we're monitoring for. They have their own account.
We called her and said, are you taking the medicine too much? You taking too much? She said, no. We went over medications. We talked about it. She said, no, but I'm feeling lightheaded and dizzy. I almost passed out. And so, yeah, your heart rate is about 42. It's going down. So we got her engaged. We cut her. We started lowering her blood pressure medication, heart medicine. Pulse still came up. She's feeling better, but still she went normal. Then the next week she started going down again. So eventually we had to make some adjustments in her medication. Now she's doing well. But here's a prime example. If she had remained on that medication, it's typical for patients to fall. She could have hit her head. She could have been in the hospital. It's been costly. It's been an adverse effect. And these things do happen. It improves the patient-doctor relationship, in my opinion, because it's not episodic care. It's not sick care. It's truly health care. It's preventive medicine. The patient are engaged 24/7.
So with Clemson Rural Health, we are able to monitor our own data versus outsourcing. We create positions just for nurses like myself to be specifically signed to the remote patient monitoring program. The community and the patients, they love to know that, hey, that nurse in that clinic, when I go for my 3 to 4 month follow-up, that's the same nurse that's giving me a call, every week, every 2 weeks, checking in on me, regardless of the alerts received. And so it increases engagement. The patients say, hey, my family practice really cares about me.
When I distribute the equipment for some of these clinics, I'm going directly into the patient's home, setting up the equipment with them. They're in the comfort of their own home. This equipment is theirs while they're on the program, and it's set up there at their convenience.
the patient is more engaged in their health. They know that, hey, I only have 15, maybe 10 to 15 minutes in this appointment, but like we're seeing that day-to-day life with the patient. And not only are they engaged, they know that, hey, I'm getting the proper education so that I can live an overall healthy life.
Makes me feel good. It makes me feel like, you know, the medical professionals care for us. So I would absolutely encourage others to be a part of the program.